Kids in school across the Bay Area are learning how to save lives thanks to Johns Hopkins All Children's Hospital and the American Heart Association. Here to tell us more about the program and to teach me some needed training is Dr. Dan Mariello. Doc,
good morning.
Welcome. So tell us about this program.
So this is a program, it's a partnership between Johns Hopkins All Children's Hospital and the American Heart Association.
Yeah.
Over the past few years, we've been rolling out these CPR kits into schools in Hillsborough, Pasco, and Pinellas counties to teach children and the students there how to do hands-only CPR.
Hands only? Hands only. No mouth, no other accoutrement, just hands only.
Just the hands, exactly. And the reason for that is every year, more than 400,000 people will suffer a heart attack. And unfortunately, most of those are going to be outside of the hospital, and most of those people are not going to receive any sort of CPR. And we know that if you don't have CPR or good medical care, your chances of survival are very low.
Okay.
Yeah.
So how many kids total are we?
More than 10,000 a year being trained to do this.
A year?
Yes.
Oh, that's fantastic.
Absolutely. And so one of the reasons for training hands-only CPR is that most people, I think, are somewhat familiar with conventional CPR. The two components, the chest compressions, which is pushing on the chest with your hands, and then there's the ventilation component, which is mouth-to-mouth that most people are familiar with. There's lots of reasons why people may not want to do the mouth-to-mouth component. Maybe there's something that's contagious. Maybe you're not sure if you're going to get something from the person. You don't know the person.
Sure.
How many times do I breathe? How many times do I push? And fortunately, what we've realized over the recent years is that hands-only CPR is just as effective as regular CPR when done outside of the hospital.
That is unbelievable. Just as effective.
It's just as effective outside of the hospital as conventional CPR with the breathing and with the chest compressions.
Wow. Okay, well, let's learn how to do it. Let's do it.
So we're going to do this. So we're going to make it really simple. So if you see someone collapse, the first thing I want you to do is call 911 or yell for someone to call 911.
Okay.
You're going to go, you're going to check and see if the person's responsive. If they're not appropriately responsive, you're going to push hard and fast in the middle of the chest.
How do you check for responsiveness?
You just, sir, ma'am, are you okay?
Okay.
If you don't get a normal, yeah, I'm fine, why are you bothering me? If they're not appropriately responsive, you're going to push hard and fast in the middle of their chest.
Okay.
All right?
Is there some sort of hand?
Yep. So you're going to put your dominant hand in the middle of the chest.
Oh, this is my dominant hand, my
and
right.
then you're going to put the other one on top of it, and then you're going to push hard and fast about 100 times a minute.
100 times a minute?
Just like that. Yep.
Are we gonna
keep
do this?
And we're gonna
Wait, do we stop it all?
We're gonna keep going until the EMS arrives, or until you get so tired that you need somebody else to jump in and help you out.
Oh, I was gonna say they have to do it on my chest.
Yeah, no, that's exactly it, though. So you're gonna get tired after a couple of minutes of doing this, and so then you're gonna say to me, "Hey, Dr. Dan, jump in here and help me out."
So what is it doing, though? Physically, what are you doing with that?
So you are physically pumping the heart. So every time you push down,
is there a way to find that spot? Now, obviously, there isn't going to be a pad there when you have somebody. So where are you pushing on them?
So you're going to just find right in the middle of their chest. If you basically
the chest bone, or are you going
right
low?
in the middle of their chest. So basically, right between the top and right between the bottom, which we call the xiphoid. So the top of their belly to right here, just right in the middle of the chest.
You're not going to crack the chest. You don't have to worry about that. You know. Okay.
So there may be things like that would happen, but if they need CPR, you need to do the CPR.
Right.
So that brings up a really good point. So a lot of people say, "Ooh, gee, I'm worried that if I do CPR on somebody, maybe I'm going to hurt them or something like that." And it's important to know there's the state of Florida, as well as all other 50 states in the District of Columbia, have something called the Good Samaritan Law, which protects people who are acting in good faith. The Good Samaritan Law, which protects people acting in good faith who are trying to render service. So it protects medical professionals, it protects people like you. You see somebody down, you do CPR, you're protected.
And when you're doing that, you're jump starting the heart.
Correct. Yeah. So you're helping the heart pump. Exactly. So every time you push down, you're pumping blood out. When you come back up, it allows the heart to fill. You're pumping blood out. You're letting the heart fill. Pumping blood out, letting the heart fill.
There could be like a blockage, and so
so it's just helping to keep that flow of blood going, getting oxygen to the brain, getting oxygen out to all the organs.
That's fascinating. Thank you so much. That was really, really.